Hi, I am Dr. R.Srivathsan. I am a consultant uro-oncologist and robotic surgeon at Apollo Proton Cancer Centre, Chennai. Today, we will be talking about prostate cancer. What is prostate gland? Prostate is a small walnut-sized gland which is present only in the males. This is basically a accessory sex gland which adds volume to the semen that is generated. The secretions of prostate are very important in order to give the glucose and the fructose to the sperm so that they can go and fertilize the ovum. Where is the prostate gland? The prostate gland is basically located at the base of the bladder. So, basically between the bladder and the urinary passage, this gland is situated surrounding the urinary passage. What is prostate cancer? The cancer that arises in the prostate gland is the prostate cancer. The type of cancer that we have in the prostate, the most commonest one is what is called as an adenocarcinoma prostate. How common is prostate cancer? Prostate cancer is now turning out to be one of the most common cancers detected in the male. Who might have prostate cancer? Any male over the age of 60 could be suffering from prostate cancer. The chances is that if you take a subset of 60 to 80 years, almost 1 in 3 males would be suffering from prostate cancer. What are the types of prostate cancer? As I had told earlier, there are different varieties of prostate cancer. The most common variety of prostate cancer is what we call as the adenocarcinoma of the prostate. Now, the prostate gland is made up of glandular structures which secrete the secretion which I spoke about earlier. Now, the cancer that arises from the glandular part is what is called as the adenocarcinoma of the prostate. What causes prostate cancer? To be frank, we really do not know what exactly causes prostate cancer. There are various risk factors which is associated with the development of prostate cancer. What are the symptoms of prostate cancer? Prostate cancer symptoms are very similar to benign enlargement of the prostate symptoms. Many a times the patient is completely asymptomatic as well. Usually when they present to our OPD, they usually present with urinary complaints like urgency, frequency, nighttime frequency, difficulty in passing urine and so forth. Are prostate problems always a sign of prostate cancer? No. There is a set of symptoms what we call as a lower urinary tract symptoms. This includes urgency, frequency, urge incontinence, sometimes there is a leakage of urine. You have nighttime frequency where you will have to get up again and again. A strain to pass urine where you have to push yourself to push the urine out, and even unsatisfied urination when you feel that some amount of urine is still staying behind. How is prostate cancer diagnosed? Once you have approached a urologist because of your urinary complaints, the urologist will evaluate your prostate by doing an examination called as a digital rectal examination. By this, we feel the posterior surface of the prostate, and which will give us an idea as to the texture of the prostate, whether it is firm or whether it is hard. If it turns out to be hard, there is a high possibility that you could be harboring from a prostate cancer. What are the stages of prostate cancer? As I said earlier, prostate cancer for clinical purposes is divided into an early stage or an advanced stage. However, going into the specifics, we follow the TNM staging, which is the tumor, node and metastasis staging. In this, the stages of prostate are divided into 4 stages. To simplify for public, basically stage 1 is when the prostate, stage 1 and 2 is when the cancer is restricted to the prostate gland. Stage 3 is when it is slightly outside the prostate gland or the nodes are involved, and stage 4 is when it has spread outside the prostate glands to other organs like bone, liver, lung, etc. What are the complications of prostate cancer? Prostate cancer, if left untreated, can lead to a lot of complications, the most common of which are urinary complaints. As I said, the prostate gland is situated right at the base of the bladder, and it can lead to urinary retention or blood in the urine which can affect the patient. How is prostate cancer managed or treated? So, the management of the prostate cancer depends on the staging of the prostate cancer. If, for example, it is an early prostate cancer which is restricted only to the prostate gland, then the treatment will be in curing the cancer. How do we achieve this cure? There are two ways to achieve this cure. Surgery called radical prostatectomy. In this, we remove the entire prostate gland as well as the seminal vesicle behind the prostate gland. We also remove the nodes which are situated and which drains the prostate gland. Thereby, by complete removal of the cancer, we are achieving a cure. What are the side effects of prostate cancer treatment? See, any treatment given for prostate cancer will have some side effects, but to a manageable level. It also depends on what type of treatment you have undergone. For example, we are doing a robot-assisted radical prostatectomy for curing a prostate cancer. Because of the removal of the prostate gland and the suture urethra and the bladder, you will have a bit of urinary leak post-operatively. This urinary leak can last somewhere between 4 weeks to 6 months. Usually with the help of good physiotherapy, this urinary incontinence can be treated. How can you prevent prostate cancer? Right, there is no general rule to say that doing this can prevent prostate cancer. Leading a healthy lifestyle can at least postpone the prostate cancer. A sedentary lifestyle, very obesity of very large BMI, all those things are supposed to increase the earlier prostate and increase the incidence of aggressive prostate cancer. Smoking and excessive alcohol intake can also lead to aggressive prostate cancer. So, avoiding all this and leading a very healthy, non-sedentary, good physical activity lifestyle, having a very good low BMI, all this could lead to at least rather a delayed development of the prostate cancer. What is the outlook for people suffering from prostate cancer? Thankfully, prostate cancer is supposedly one of the more benign of the cancers that we can have. It does not mean that it is not aggressive. It basically means that there are various ranges of types of prostate cancer from almost benign to very aggressive cancer. It depends on what type of cancer that you are suffering from. However, whatever type it may be, the outcomes are very good with the latest treatment, whether it is early or advanced. Even if you cannot cure the cancer, you can keep the cancer under control, have a good quality of life even up to a decade after your diagnosis of advanced cancer. I have tried to answer in a simplified way what is prostate cancer and what can be done to treat it and to cure it. Hope it was useful to all the listeners and the viewers who have seen it. Thank you. Stay safe, stay healthy, stay informed. If you suffer from any of the symptoms that I mentioned in the videos, any urinary complaints which could be related to prostate issues, please do consult a nearby urologist or a uro-oncologist to make sure you are healthy and informed.